a new report commissioned by Dental for All, a group of health professionals, unions and campaigners, are calling for universal dental care. They've looked into the social, economic and fiscal costs of New Zealand's current dental care model. The report uses New Zealand and international studies and on dental care across and along with Treasury cost benefit analysis to make some estimates. So they estimate found a lack of access to dental care could contribute up to $103 million in sick days a year and $2.5 billion in loss of work productivity. But of course, in New Zealand, routine dental care is free for under 18-year-olds. There is also emergency dental care available through the public health care system and a means test work and income grant available for dental costs under $1,000. So, you know, again, as I was saying before the break, this is something that year in, year out, we seem to talk about. New governments come on board and they are, you know, lobbied to do it as well. Maybe it is time. Dr. Robin Whyman from the New Zealand Dental Association joins me now. Robin, good afternoon.
Good afternoon. How are you?
Well, look, I'm good. I mean, the conversation of free universal dental care has been bandied about, hasn't it, for many, many years. And I talked about the sick days and the lost work productivity. Is there, do you think, a case now for free universal dental care?
The Dental Association's not quite convinced that we need to go as far as free universal dental care. There's quite a complex issue sitting in behind this. So let me just back up. The World Health Organisation's got an idea of called universal health coverage, and it doesn't just talk about oral health, it talks about all sorts of health services. And it talks about the fact that everybody should have access to a health service without a financial hardship causing a barrier to that service.
Sure.
And so I think in talking about oral health care, particularly given where we are today, it would be a very big leap to move from where we are now to universal free. But the Dental Association certainly supports the idea that in aspiring to that universal health coverage ideal, that we should be improving our access to dental care for people who find it hard to access care, for groups that we know where we've got a bigger chance that there's going to be knock-on effects into things like sick days, potentially admission to hospital, or making access to care difficult. So we certainly think it should improve, but it's a big leap to think that we could go to universal free. And it's not just the money. You know, you'd have to think about, well, have we got the workforce, have we got the facilities, all of those things that become a much bigger issue to think about. Yep.
Yeah, actually, I'd like to touch on that because, I mean, how many dentists are we training, Robin?
So the University of Otago is our only dental school in New Zealand for training dentists, and they have 60 funded places a year for dentists. That number has actually dropped to 54 for quite a lot of years after the 1980s, and then that's probably getting on for 10 years ago, it jumped back up, it pushed back up towards 60. So we really haven't moved beyond 60 since the 1980s, and yet we all know what's happened to the population in that time. So the number of dentists in New Zealand has been driven partly by obviously our output and how many we can keep in the country, and that varies a bit depending on what's happening around the world. And then a proportion of our dentists, around about a third, who have moved to New Zealand from overseas and provide very good care because there is stringent access in terms of making sure quality of care is properly regulated before people start practicing. But it relieves us very vulnerable to the international winds of change, things like COVID, and then we don't have that workforce coming in. So we are concerned that our own training numbers are a contributing issue that would need to be thought about at any aspiration to improve the situation. Yeah.
Would that contribute to the fact we've only got 60, or you said lower than that, high 50s being trained per year? And I gather it takes more than 1 year before they can pop out. Will that go towards the expense of going to a dentist? Because Robin, you know, that's what people say. Most people say it's just so expensive to go to a dentist.
Yeah. Oh, well, in part it will. I mean, let me just be, to defending the University of Otago's program. They do a very good job. So they've got 60 a year funded places. They do train a few more than that if people are full fee paying. But then you're talking about, an extremely expensive course. So, and then they have some overseas funded students who are training at Otago, but perhaps moving back to countries where they've been supported from. So, yes, going to your question, yes, it will contribute because, of course, people are graduating with significant debt from dental programs, just like they are from medicine and other professional programs. So that can be, $100,000 plus by the time they graduate. But the real contributor to the cost of dentistry and what people see when they visit the dentist is that it's largely an unsubsidised healthcare service. So the cost you're paying to see the dentist is the full cost of the service that you're receiving. And that's why people see it as very different to going to see the doctor because, of course, GP care is partly funded by the government and then there's a part charge to the individual patient. So people do tend to compare the two and go, why is it so expensive to go to the dentist? Well, in a large part, that's because you're paying the full cost of the treatment. And, it's an expensive business to run. It's got a lot of capital equipment, things like dental chairs and the equipment to deliver dental care. So, and high standards, things like, that everybody expects, like proper infection control and things.
So routine dental care is free up to the age of 18. Would you like to see that age extended?
So the association's suggestion is that, based on what we see in terms of the difficulties of access, if you want to set people up well to go forward into their later adult years, and also the higher levels of where we see acute admissions to hospital, the association suggestion is that two things should probably be the place to start. One is extending that funded care up to the mid-20s would be our first suggestion. And the second is that then where we have other groups of population, that might be a geographic area, that may be particular population groups, that may be groups with particular disabilities or health problems, that we could look at specific programs for particular groups of the population. They would be our two suggested areas of how to improve access to care.
Sorry, Robin.
Some of what
Could you go into more depth of who other groups would be?
Well, we've certainly seen examples around the country where there are towns that have struggled to get a dentist, and it may be that, under the Te Whatuora model of looking at particular areas or localities, a good example we know about that's been in the news has been Dargaville, and another one will be Wairoa. You might look at funding a service in those particular areas where, practices have struggled to set up. It may well be that we're talking about people with conditions that we know are linked to poor oral health, so things like diabetes and severe, and also perhaps cancers linked to higher needs to have oral health care. Those sort of things you might look at particular groups, and it may be that you look at particular Māori Pacific groups where we know there are very high levels of disease, and if we don't manage those diseases, we'll get the kind of problems that are talked about in the report, where there's knock-on effects to being admitted to hospital, high levels of sick leave, inability to work. The social cost of that becomes higher than the cost of actually making sure we fund the dental care.